Sorting through food-triggered symptoms and reactions can be challenging because there are multiple ways in which people can have symptoms triggered by foods. Today, I want to focus on food allergies and sensitivities, but we cannot have an appropriate understanding of food-related reactions unless we at least mention the varying potential root causes of these symptoms. Food reactions and symptoms can be triggered by digestive imbalances, bacterial imbalances, or an immune response. Digestive imbalances can be things like exocrine pancreatic insufficiency or not making enough digestive enzymes in general, and eating almost anything can be uncomfortable. Or not secreting enough bile with your meals, such as after your gallbladder has been removed. Or not making specific enzymes, such as lactase, which breaks down lactose, the sugar in certain milks, or diamine oxidase, the enzyme that breaks down histamine in the gut. Microbial imbalances can trigger food-related symptoms, such as the irritable bowel syndrome associated with small intestinal bacterial overgrowth, which is where colonic fermenting bacteria have colonized the small intestine and ferment slowly digested carbohydrates. Finally, immune reactions. This is where the immune system gets triggered to produce antibodies to specific proteins, creating either a type 1 or type 2 hypersensitivity reaction and potential inflammation. So as you can see, it can be a challenge to sort through food-triggered symptoms, and this is where you can be a huge help by keeping a food and symptoms journal to document what you eat, when you have symptoms, and what these symptoms are. Today, I want to focus on the immune response to foods, the type 1 and type 2 hypersensitivity reactions I mentioned earlier. It is important to note that the increase in allergies over the last 50 years has been dramatic, and according to the Food Allergy and Research Education statistics, food allergies have increased 377% between 2007 and 2016. Food-related allergy symptoms can include hives, nasal congestion, sneezing, itchy watery eyes, vomiting, stomach pain or diarrhea, swelling, shortness of breath, or wheezing. Common food-related sensitivity reactions include digestive issues, headaches, joint pain, skin rashes, fatigue, behavioral problems, autoimmune disease, heavier painful periods, or irregular periods. Type 1 hypersensitivity reactions are a true food allergy and can become life-threatening. This reaction occurs either immediately or up to 3 hours following exposure to a triggering protein. It takes multiple exposures to a food for your allergy response to fully develop. Initially, with your first exposure to a triggering protein, an IgE antibody is created. Then with each re-exposure to that same protein, your body will eventually release histamine from mast cells, a type of white blood cell that is present in tissues throughout the body, such as your skin, lungs, nose, connective tissues, and near your blood vessels. There's no way to predict when your reaction could escalate to anaphylaxis, which is when your throat closes. But the idea is that a food allergy can develop into a life-threatening event. Children have been known to outgrow some food allergies. This depends on the severity of the reactions and the type of food that they were reacting to. Typically, food allergies which develop as an adult are permanent. The most important thing to remember is that we can develop allergies at any age, or we may not notice allergic responses until we have had years of exposure to a food. Testing IgE in the bloodstream is considered the most accurate way to test for food allergies. Type 2 hypersensitivity reactions are not life-threatening, but can still be life-altering. These reactions can occur anywhere from 3 to 72 hours following exposure to a triggering protein, thus making it extremely difficult to identify the culprit. In this case, the body can develop IgG antibodies or trigger the complement inflammatory pathway in reaction to specific food proteins. I want to spend some time talking more in depth about this because of the controversy surrounding IgG testing for food sensitivity. Immunoglobulin G is the most common antibody in the blood. It is produced after a period of time to a triggering protein. Some providers claim that IgG reactions are a marker of food tolerance rather than food intolerance. Others state that since IgG is the most abundant immunoglobulin, it is too nonspecific. And still others state that IgG antibodies will develop to any food eaten if a person has a leaky gut. Understanding food reactions in the gut is a lot more complex than just having IgE or IgG reactions or a leaky gut or not. While there certainly is a correlation between a permeable gut membrane and food reactions, there are other cells in the digestive tract that can react to food proteins, such as the Peyer's patches, part of the lymphatic system in the gut. People can develop food reactions and have no permeability issues in the lining of the gut. And even when an individual has a permeable gut membrane, they do not necessarily develop reactions to all the foods they are eating. So this is why testing can be so helpful in uncovering the root cause of these symptoms. Over the last few decades, our understanding of IgG has expanded, particularly its subtypes, IgGs 1 through 4, its relationship to IgE, and other inflammatory proteins. There was a time where it was noticed that when IgE was elevated, IgG4 was also elevated. So there was a period of time when IgG4 only food sensitivity panels were run, but these have been considered unreliable. It is now understood that IgG4 actually is not an allergic or sensitivity reaction, but rather it blocks the effect of IgE, creating an immune tolerance. Incidentally, this is how immunotherapy injections work for environmental allergies, by triggering the development of IgG4 immunoglobulins. However, there are a number of studies that have demonstrated a significant correlation between symptoms and across the board IgG-specific reactions, such as this study published in 2012, which demonstrates a significant reduction in diarrhea with IgG-specific food exclusion diet, and a similar study published in 2004 showing the same thing, improvement in IBS-D symptoms based on food elimination of IgG-reactive foods for 12 weeks. There have been many specialty food and allergy and sensitivity tests available on the market, many of which test only one marker, such as IgA, which is definitely not reliable, only IgG or only IgE, or even just some inflammatory markers. I have done all of these tests over the years and often been very unimpressed with the results that I have seen in my patients. What I have learned is that testing markers in isolation does not provide enough clinical evidence to produce results and create an effective elimination program. These antibodies and inflammatory proteins do not work in isolation in your body. It is important to measure antibodies together to obtain a clearer picture of your immune response and to put this into the context of your symptoms. For example, IgG can cause an additive effect to IgE antibodies, increasing histamine release. Both IgE and IgG will become more reactive when complement is present. IgGs 1, 2, and 3 bind to complement, but IgG4 does not. Remember, IgG4 actually does help build tolerance to an IgE response. But complement can increase the effect of IgG by 1,000 to 10,000 fold. So it is important to look at IgG and complement together. I have had the most success with comprehensive testing, which looks at 5 different markers: IgE, IgG, IgG4, complement B, and complement D. So where do you start on your journey to get to the root cause of your symptoms? If you have not done any testing and you are seeking more concrete information that you can use to build a specific plan, then I do recommend food allergy and sensitivity testing or gut health testing. You can see the link below to my lab store where you can order your own testing and begin to collect actionable data. When it comes to treatment options for food allergy or sensitivity reactions, the recommendations do vary slightly based on the underlying root cause of your symptoms and your personal test results. Again, sorting through if you suspect you're having digestive related issues, microbial related issues, or immune related issues really is key. A general rule of thumb is to avoid all IgE reactive foods forever or until you test again and miraculously are no longer reactive. For IgG and complement reactive foods, I recommend avoiding these for 3 months, then starting a slow reintroduction program. I have seen some food sensitivity results come back where individuals are sensitive to many items. This can take some time to sort through with a provider to develop a personalized plan that makes sense for you. Just removing your reactive foods is often not enough to alleviate symptoms. I do recommend key nutrients which can be helpful in part of a comprehensive plan. I do think that addressing the gut lining, whether or not it was the initial cause, is important in terms of healing once you've developed food reactions. I really like the GI Integrity and GI Defend. I recommend that you mix both of those powders and take 1 scoop twice a day for 2 weeks, then 1 scoop of each once a day for 6 months in order to help calm the immune response. I generally do not recommend taking probiotics unless you have done a specific gut health test and you know what your microbial environment looks like. Lifestyle factors are also an important part of any healing protocol. Managing stress, maintaining hydration, incorporating movement, and ensuring a good night's sleep are all foundational in order to alleviate symptoms. Food reactions can be a complex issue to understand. For many individuals, not only is there the food reaction itself, but then the stress and anxiety that results from not knowing what is going on. Stress, psychological or physiological, can exacerbate any underlying condition and make symptoms feel even more overwhelming. You can begin to take control of your symptoms. Start your own symptoms journal today and document what you are experiencing. Then consider meeting with a knowledgeable healthcare professional to help you put together a plan for testing or lifestyle interventions so that you can address your symptoms in a multifactorial way, both diet, lifestyle, and with actionable evidence. Take care.